everyone who wants to protect themselves can. For example, the government should still have rules in place. For example, if you're can't socially distance indoors, you should wear a mask. Both of us should be wearing a mask. Now, we're far apart here and we're outdoors, so not an issue. But indoors, we should have these rules. But don't stifle the business. Let the business continue. Let people make the choice to go on, because the option of closing down is worse than what the coronavirus is doing.
David Menzies for Rebel News here in Richmond Hill, Ontario. And folks, before I get to my story, please, if you can, go to journalistdefensefund.com. If you're able to, make a donation. Sometimes we have legal fees, sometimes we have to hire bodyguards, but it's all worth it when it comes to bringing you the other side of the story. Well, I am with Mr. Carmine Perrelli. He is the Deputy Mayor of Richmond Hill. He is also a York Regional Councillor. And Carmine, the reason why we're here today is that when the people of York Region woke up this morning, guess what? They woke up to a whole bunch of new economic lockdowns. York Region is joining Peel Region, the City of Toronto, and the City of Ottawa in a modified Stage 2 lockdown. And let me get your take. First of all, is this the right route for the Premier to be going? He said last week, I pray that I don't have to put more areas into a Stage 2 lockdown. And I guess prayers are not enough, because here we are in a Stage 2 lockdown. And this was a Premier that ran back in 2018 on the campaign slogan, Ontario, open for business.
Well, thanks for having me, David. Look, the reality is that I believe as a basic philosophy that government should only intervene when on issues where people can't take care of things themselves. For example, I believe that back in March, when we were first informed of this virus, it was important to find out how this virus affected people, how to protect ourselves, make sure that we start working on things to help mitigate the causes of it, work on a virus and all of these things. Now, these are things that individuals cannot do for themselves. And yes, that's the government's role, to put their resources towards getting all this done, especially having protective equipment. But today, David, we know that we met our goal from March, which was to flatten the curve. We met that goal in August. And I agreed with all of that philosophy. We had to take measures. The government had to step in to protect people, because people could not protect themselves. But today, David, you and I both know, and everyone knows exactly how the virus is spread, how to protect ourselves, what the hospitals need to do to prepare themselves. And the government should still be involved in the things that we can't help ourselves with, which is continue to work on vaccines, continue to work on any medicine that could help alleviate the symptoms of COVID-19. Continue to research, but the government should not be making decisions that people can make for themselves.
You know, I think that's well said, Carmine. And here's the thing. I mean, Doug Ford has continually stated that, you know, it breaks his heart to shut down any businesses. He's an entrepreneur and a businessman himself, of course, but he has to defer to the health authorities, the doctors, the medical scientists.
Well, which ones, David?
That's what
the question. The question is, which medical authorities are you going to listen to? If you listen to the World Health Organization, they will tell you that lockdowns are not a long-term solution.
Afford it. This is a terrible, ghastly global catastrophe, actually. And so we really do appeal to all world leaders. Stop using lockdown as your primary control method. Develop better systems for doing it. Work together and learn from each other. But remember, lockdowns just have one consequence that you must never, ever belittle, and that is making poor people an awful lot poorer.
And we've seen it. Depression, suicide rates, spousal abuse, people dying on elective surgery lists. So now that the WHO has said this isn't the route to go, where indeed is Premier Ford getting his medical advice from?
I'm not sure, but here's what I do know, David. I know that since last week's regional council meeting, wherein I asked our medical officer of health, Dr. Kurji, I said, Dr. Kurji, I understand that back in March, the government need to intervene because there were a lot of unanswered questions and we as a public couldn't take care of ourselves. But now we know what we're doing. We know how to prevent it. We know how to stay away, stay safe. We know that the government still needs to do certain things. But let me ask you this, Dr. Kurji. Since we flattened the curve and we met that objective, why are we shutting down again? Why are you even contemplating shutting down again? And he couldn't answer me. I've asked 4 different ways and he couldn't answer the question. As a matter of fact, Dr. Kurji stated, and it's all on Zoom meeting and it's all recorded, that he doesn't believe we flattened the curve in August. So my question was, well, if we didn't flatten the curve, then why did we loosen the restrictions?
We have seen government invest in advertising campaigns urging people to get fit, to work out, to curb obesity, to curb diabetes. And yet here they're taking this away from us. And yet a big box store like a Costco or a Walmart, they remain open. I mean, does this make any sense to you?
No, I don't believe they're applying the same standards across the board. It's kind of a pick and choose as you go along. I think it's maybe out of desperation. I mean, you know, if I were the premier, I'd be worried about people's lives and I wouldn't want to make the wrong decision. But I think this is a balance between making a decision where people might get sick and might die versus what are the long-term effects and impact of shutting down restaurants. 1.1 million people in the province of Ontario are employed in the hospitality industry. And statistically speaking now, they're saying that maybe 60% of those restaurants will never open again. We'll have to close. We know historically, David, that restaurants are one of the toughest business to make a go at. Add this level of complexity and barriers, and I think that they may be right. 60% of businesses will not reopen. But it baffles my mind as to why 4 of us in the same bubble, right, can go grocery shopping, we can go to Home Depot together, we can meet together. Why can't we go to a restaurant and sit at a table together?
It is baffling to me, Carmine. I'll give you an even more wild example. You can indeed socially distance at a gym or right here at this bingo parlor, which is now closed down as of today. But on the way over here, I actually drove past a massage parlor. They're open for business. How do you compute that?
I'm not a mathematical wizard. I can't make that computation. Even with a calculator, I couldn't do that. It doesn't make a lot of sense.
Yeah. I mean, from the point of view of social distancing, there is none.
There is no social distancing. I mean, if you go to a grocery store who has a hot table and you get in line, and people are standing right behind each other in line to pay and so on and so forth, or they're sitting outside. You've seen some of these patios outside that are enclosed with tents. Now, is that an outdoor patio because it's in the parking lot, but it's enclosed? It doesn't make a lot of sense. I think that we need to apply the same philosophy that I said at the beginning of this interview, and that is government should do what people cannot do for themselves. But if we have a choice and we know what the choices are, we should be able to make those choices.
Carmine, if you had the Premier's ear, what would you tell him? First of all, would you say lift this stage 2 lockdown because the people of York Region are already hurting and barely hanging on as it is?
I've already said it, David. I said it during a regional council meeting, and I said to Dr. Kurji, in the absence of knowing what the end game is and the goal, then there should be no more restrictions. We should open up business as usual, and everyone who wants to protect themselves can. For example, the government should still have rules in place. For example, if you're can't socially distance indoors, you should wear a mask. Both of us should be wearing masks. Now, we're far apart here and we're outdoors, so not an issue. But indoors, we should have these rules. But don't stifle the business. Let the business continue. Let people make the choice to go on, because the option of closing down is worse than what the coronavirus is doing. Look, so far I have not had anybody tell me that our hospitals are overwhelmed. The hospitals have lots of room. And if that's the case, then look, some people will catch the virus. Thank God, right? The percentages are going down of the fatalities. Originally, we were looking at 6 to 8% of the people contracting the virus were dying. Now, it's about 1%. And that's good news. And the reality is that when you have numbers that low, sadly, of course, one life lost is one life too many. But the numbers are no different, as you stated earlier, than the flu.
Carmine, I want to thank you so much for being the straight shooter with us that you always are. Thank you. And I guess if Premier Ford, if you're watching this, come on. I think one of the greatest lies that come out of this pandemic is the phrase, we're all in this together. No, we're not in this together. Maybe if you're in the bureaucracy or government or so-called essential service, nothing's happened to you or your income. But when you go around the province, when you see the suffering, the number of businesses putting a going out of business sign in their window, this is a travesty. And for someone who ran on the platform of Ontario Open for Business, you, my friend, should have been their advocate, not their potential destroyer. For Rebel News, I'm David the Menzoid Menzies. Well, folks, bringing you the other side of the story does not come cheap. Sometimes we need security in order to bring you the other side of the story because there are forces afoot that don't want us to bring you the other side of the story. If you can, please go to journalistdefensefund.com. That's journalistdefensefund.com and make a donation.